Communicating for Antibiotic Stewardship. This video is part of the Communicating for Antibiotic Stewardship series. Videos in this series provide evidence-based training on fundamental communication skills that primary care providers can use to reduce patient expectation for antibiotics while maintaining their satisfaction with care. Advising on symptom management. Patients with viral illness need symptom relief, not antibiotics. This video presents 5 strategies for giving symptom management advice to help improve patient satisfaction with non-antibiotic treatment, encourage adherence to your recommendations, and reduce the likelihood of subsequent antibiotic seeking. These strategies are: A. Describing symptom management as real medicine. B. Emphasizing effectiveness and feasibility. C. Addressing advice limitations and consequences. D. Giving instructions for use. E. Helping patients follow through. A. Describing symptom management as real medicine. Providers sometimes make symptom management sound like a second-best option compared to antibiotics. For example, it would be great if we could treat this with antibiotics, but we're stuck with over-the-counter options. Don't undercut your own recommended treatment. Instead, convey that symptom management is the most appropriate and useful way of treating viral illness. Here's an example. Because this illness is viral, antibiotics won't help you, but I can give you ways to be more comfortable while your body fights off this virus. B. Emphasizing effectiveness and feasibility. If patients don't appreciate the value of your recommendations, they may not bother to follow them. To address this problem, explain why the products or behaviors will help and what makes them easy or convenient. For example, ibuprofen will help with your achy muscles. If you don't have some already, you can get it from any drugstore. For advice that is harder to carry out, acknowledge feasibility concerns and emphasize effectiveness to encourage adherence. For pseudoephedrine, you could say, getting pseudoephedrine can be a hassle because you have to show your driver's license at the pharmacy, but it does the best job with relieving congestion. Be prepared with alternative suggestions if patients express concerns about particular products. C. Addressing advice limitations and consequences. All treatments have limitations, and some can have negative consequences, such as side effects or allergic reactions. Learning from you about a product's limitations will help patients have appropriate expectations. For example, a cough suppressant will help reduce coughing, but it won't clear up your stuffy head. For that, you also need a decongestant. Discussing side effects or allergic reactions is important for patient safety and well-being. To illustrate, pseudoephedrine keeps some people awake if taken too close to bedtime. You can avoid this by taking it early in the evening. D. Giving instructions for use. Remember that your patient may not know the best way to use over-the-counter medications or follow other recommendations. Start by asking whether they are familiar with what you've suggested. For example, have you used a saltwater gargle before? Based on the reply, provide instructions as needed, keeping them as simple and step-by-step as possible. Dissolve a spoonful of salt in a cup of warm water. Gargle the salt water in the back of your throat for as long as you can and spit it out. Do this 2 times a day. Encourage patients to ask questions, and when instructions are complex, supplement them with a written version. E. Helping patients follow through. Patients are more likely to follow your symptom management advice if you help them remember what you've suggested. Whenever possible, provide a list, making sure to note both brand and generic names to prevent confusion later. Some patients will need additional support to manage their symptoms after their visit, so make sure they know how to get it. To illustrate, if these products don't make you more comfortable or you think you're getting worse, please call or message me. In summary, to promote antibiotic stewardship, use these 5 strategies for giving symptom management advice. A. Describing symptom management as real medicine. B. Emphasizing effectiveness and feasibility. C. Addressing advice limitations and consequences. D. Giving instructions for use. E. Helping patients follow through. For additional materials to develop this and other communication skills for antibiotic stewardship, visit the following website: